Hello, my name is Alexandra Moldovan. I'm a third-year student at Cluj School of Public Health from Cluj, Romania, and I'm going to present to you today a systematic review on gymnasts and eating disorders. Due to pressure of the sports environment, eating disorders are usually a common thing among athletes. Compulsive behaviors such as eating patterns and compulsive and excessive exercise are seen as normal behaviors in this field. Coaches and parents are also the ones that increase the concerns about body shape and size. Characteristics such as high achievement, perfectionism, and control are in nature of competitive sports. Well, this systematic review aims to find out if coaches and parents are the ones who pressure gymnasts the most in performing. Also, it aims to highlight the most prevalent risk factors in developing eating disorders among elite gymnasts. The study focused on scientific literature dedicated to eating disorders in gymnasts and the implied risk factors on a global level. Furthermore, I was interested on what role parents and coaches play when influencing and pressuring gymnasts to perform. The research was planned to be performed using an online database, PubMed, and to respond to the research questions, the inclusion criteria was articles in English published in scientific journal, and the year of publication wasn't taken into consideration. The initial search criteria, by using the exact phrase eating disorders in gymnasts, resulted into a total of 20 articles. Then the relevance of each paper was tested by scanning titles and abstracts. During this phase, I traced the trend in emphasizing the relationship between eating disorders and gymnasts, but also the importance of coaches and parents in developing this kind of diseases. Following the literature scan, I selected 7 articles relevant and included them in the analysis part. And the results show that gymnastics is a field in which the risk of developing an eating disorder may be unusually high, gymnast coaches being particularly concerned with athletes' weight and shape. Besides the fact that their self-conscious influences themselves in taking this kind of decision, studies show that coaches and teachers also play an important role when it comes to this. Peers and parents can also play a role either in developing an eating disorder or in helping to prevent it. Another major risk factor for developing eating disorders appears especially to gymnasts at a competitive level. For example, other studies show that high school girls have no distortion of their body image of the abdomen, while gymnasts have a mild one. The low body mass index of elite gymnasts is usually discussed in relation to stress, hormone levels, and calorie intake, but also with genetic factors. Generally, athletes seem to be more at risk than non-athletes, and under certain circumstances, the participation of women in each sport may constitute a risk factor. Not only coaches, but parents and athletes as well should find sources and educate themselves in order to prevent eating disorders. A major limitation of the study is the fact that I have only searched for the exact phrase eating disorders in gymnasts, and I didn't search for any other relevant topics. Another limitation may be the fact that I have only used PubMed as a search engine. As a conclusion, even if gymnastics is not actually considered to be an endurance sport, female gymnasts appear to be at higher risk to develop eating disorders due to their coaches, parents, peers, but also because of their beliefs of perfection. Nevertheless, this study is just an insight and a beginning, and future research needs to be done on this specific topic for intervention development in gymnastics. Okay, so that was all. Thank you very much for your attention, and if you have further questions, I will be glad to answer them.